Dr. Bouteaud, in my practice, women often come in a year and a half or 2 years following a breast cancer diagnosis, and they are now ready to take care of their menopausal genitourinary syndrome. Do you have a similar experience?
Yes, I absolutely have found this in my practice as well. We see that there are really many factors at play. Once the cancer diagnosis is made, the focus is on surgery, chemo, completing radiation, the treatments. All the information that is shared is very focused on these steps, which amount to a significant mental load, and there is a lot of stress that comes from all this. And then, there's the return to normal. Getting back to daily life, to sexual relations. That's when some patients will come to us and say, "This isn't working."
So, we do the same checkups, etc., and then, once in your care, how are the treatments you recommend to these patients different from treatments recommended to women who haven't had breast cancer?
In terms of lifestyle changes, we can refer to the previous segment. It's totally valid. Avoid irritants. The skin is thin and fragile. It's the same thing. For conservative treatments, over-the-counter moisturizers can be used regularly 2 to 3 times per week. So again, everything we mentioned in the previous segment still applies. There's even more data suggesting the benefit of hyaluronic acid-based products for women who've had breast cancer when choosing an over-the-counter vaginal moisturizer or lubricants, which, as I mentioned, really are for sexual relations. Silicone-based products have shown superior results in these patients. For some highly symptomatic women, we still recommend hormonal treatments with local delivery to help with symptoms and overall quality of life.
Do you also recommend alternative treatments using psychology, sexology, or perineal rehabilitation?
It's critical, especially for patients who've been diagnosed with cancer, whether it's breast cancer or any other cancer. We've observed that there is still a psychological impact related to the diagnosis itself. In terms of libido and sexual drive, we see that after cancer treatments, this impact can be major. For these patients, we really recommend a multifaceted approach that might be a little more vigorous, including work in sexology, which can be a really useful tool. Then there is perineal rehabilitation to help relax the pelvic floor, work on the quality and elasticity of the tissue, in addition to local treatments, moisturizers, lubricants, and then, possibly, hormonal treatments, depending on the patient.
As for aromatase inhibitors, we still have to proceed with caution for those treatments. Can you elaborate a bit more on that topic?
Yes, of course. The third group of patients we see are the patients that, following their first treatments for breast cancer, are encouraged to continue to take aromatase inhibitors for generally 10 years. The purpose of the aromatase inhibitor is basically that there is zero estrogen circulating in postmenopausal women. Ovaries stop producing estrogen. So, the amount is very low, but it's not down to zero. Aromatase inhibitors are there to take the estrogen that is active and produced by the rest of the body and bring it down to the lowest possible level, near zero. So these patients will undoubtedly see a drastic drop in their hormonal levels and experience more severe symptoms that will appear very early on. They may be very symptomatic, and this can have a significant impact on their quality of life. So for those patients, all recommendations in terms of lifestyle habits, conservative treatments with moisturizers and lubricants for sexual relations will apply. But as for hormonal treatments, there is obviously a bit more hesitation in using them. Can vaginally administered estrogen slightly increase circulating estrogen levels? It's possible. For certain women with severe symptoms, we still recommend hormonal treatments delivered locally to help alleviate symptoms and improve quality of life. As for progesterone, there are currently no contraindications for women treated for breast cancer and who are under treatment with an aromatase inhibitor. So far, we haven't seen any signs that it increases the risk of relapse, but we only have 5 or 7 years of experience with these products.
Thank you so much for your outstanding contribution here today. This completes our segment on genitourinary syndrome in menopausal women. Thank you.
Thanks again.